I want to say a happy new year to all of you and to wish you the very best for 2023. Let me say that your government has been working around the clock to fulfill the pledges we made to you during our 2022 election campaign. Our pledges are based on our 7 foundational pillars, which are food security, green energy transition, economic diversification, sustainable industries, the creative economy, COVID-19 recovery, and social protection. As I've mentioned before, I'm joined by my fellow cabinet members, and each will give an update as to the progress and plans of their various ministries for this year. We made a pledge to govern with transparency, integrity, and accountability, and we intend to continue to keep that pledge. The St. Kitts Nevis Labour Party was in the vanguard of the investments made by our national political heroes to improve the quality of life and health of our people. This founding principle remains the bedrock of our administration. We are committed to serve with the sole purpose of ensuring that every policy, every plan, every project is for the betterment of all. Our mission is to transform the lives of our people by advancing our economy in ways that will provide greater socio-economic opportunities. I would like to say at this time that our Citizenship by Investment program has been transitioning, and it has been transitioning well under the leadership of our new CEO, Mr. Michael Martin. And at this time, I want to thank the past CEO for his contribution. I would also like to add that there are a number of critical areas, but I would leave those areas for the ministers, whether it be energy, water, tourism, the good governance agenda, agriculture, the creative economy, youth, sports, education. But in my opening statement, I want to touch fundamentally on the issue of health care. Now, January 30th this year will mark the 80th anniversary of the 1935 Buckley's Uprising. This event marked a turning point in our social, economic, and political journey to self-determination and nationhood. Blood, sweat, and tears were shed to improve health and healthcare services, as among other things. Your government understands the history of workers' struggles and the sacrifices they would have made. And one such hero is Joseph N. France of Mount Lily Nevis, whose name proudly stands on our General Hospital. Let me say that from the onset that the JNF Hospital has its strengths and weaknesses. And of course, there's always room for improvement. And as was promised, it will be converted into an excellent tertiary care, secondary tertiary care institution. But I want to take this opportunity to thank all of those who work so tirelessly hard at the JNF Hospital, whether they are nurses, doctors, lab technicians, X-ray persons, phlebotomists, they work in the lab, whether they are the cooks, those who maintain the grounds, those who clean. Whatever role persons play at the hospital, I want to thank them for their service. I want to also thank as well those who are now coming in to really administer the direction of the hospital. I would like to say that your government welcomes any critique and recommendations with respect to the hospital or healthcare. We inherited a health workforce with many who are competent and dedicated to duty. They were seriously tested during the COVID, and the healthcare workers, we must admit, they did their best. So on behalf of a grateful nation, I wish to express profound appreciation to the health personnel who put themselves on the line, and also their families when they risk exposure to the COVID, when we did not even fully understand the extent to which it would have affected us. So I think they need to be honored for that, and that is why we decided that they should get an honorarium. However, I must state that the staff and medical professionals function under a culture of repression, oppression, and suppression. So much so that the planning meetings were the exceptions rather than the norm. Verbal abuse had become the norm. Being passed over for promotion and training had also been a serious problem at the hospital. Lack of meaningful communication as well. Medical doctors were working on this step. That had become a norm, and you remember when I criticized that. Workers were afraid to talk. In the circumstances, highly qualified, competent, and experienced personnel left the service. And so we are saying that the culture must change. By August 2022, the lab staff had declined by about 50%, and we found no concerted effort really to replenish that. In short order, a situation analysis was done. The strong and weak areas identified and recommendations made. One such recommendation remained to be fully addressed, and that is to recruit new specialists, meaning technicians, therapists, technologists, doctors, and nurses, which we have started thus far. That work is in progress, and it is already resulting in positive results. There was no principal nursing officer for 7 years. That is a serious breach in the administration of nursing care. We are now in the process of quickly correcting that, as we have now circulated ads to get persons interviewed to take that critical position up. There was no director of health institutions. This was corrected in mid-September when we appointed Dr. Jensen Morton to the position as well. As well as having a person who will deal with operations, who is, that person is Mrs. Maynard. To date, we have made sure that the Sandy Point Hospital has a full cadre of medical professionals, doctors rather, when this used to be done on a call basis. The issue at Mary Charles is also being quickly addressed to make sure that at that hospital also there will be doctors who can treat the patients who would access care there. We are currently, of course, advancing the training of the medical health professionals. Over 250 healthcare workers were trained in ACLS, BLS, and PALS. These are training that are necessary for any doctor to practice. Over 250, as many had been practicing without the requisite certification. I also wish to announce that we are already making moves to upgrade the EMS so that those who work as EMTs can advance themselves to become paramedics and offer better health care for our people. When we did the audit of the JNF, we recognized quickly that when it came to the financial operations, that JNF had become severely wanted in that area. We recognized that we had owed suppliers significant amount of money, some of whom were threatening not to continue to supply the JNF, but we would have said to them this is a critical situation and we would need them, and so they continue to do so as we are resolving that problem. So the hospital situation was analyzed and your government acted fast to prevent things from falling apart. 2 lines of action are now ongoing: stabilization and transformation. That is what we are doing right. Both require new staff, new systems, and a new culture of empathy, respect, collaboration, and excellence. And of course, all of this would require some amount of resources. I want to take this opportunity to say that Dr. Jensen Morton, the new director of health institutions, inherited, among other matters, a lack of equipment in the eye clinic. This means the eye clinic has not been able to perform critical surgeries, but we rectified that quickly by investing over $700,000 to purchase new equipment so that we can start doing at least cataract surgery. Presently, there are no cataract surgeries being done in St. Kitts and Nevis, which means that persons are blind, are going blind, and we are seeking to address that as quickly as possible. With respect to the MRI, as I've said, we have ordered that, and that is being built to be shipped to us as quickly as possible. Also want to say that Dr. Morton inherited 2 lawsuits and the matter of a seriously ill victim that we are working through as well. And therefore, I want to say today that Dr. Jensen Morton, along with his team, are working very hard to correct a lot of ills that had become a fundamental part of what the JNF was or is. And I want to congratulate him for what he's doing, and you will definitely see the results of that hard work. And so I want to say a number of critical things that are being done within the Ministry of Health. One of them being we are getting ready to start the universal health care, where we'll start to communicate with our people as we spoke about universal health care for all our people. We are looking at corporatization of the JNF so that we can properly continue to manage it, to improve its management as well. We are looking to strengthen our partnerships that we have with CAFA, PAHO, and a number of NGOs such as PALS so that all can be a part of our new trajectory going forward. So if you were to ask me, I'm quite pleased with the significant changes that are being made, with the systems that are being put in place, so that all these long-standing problems within the health sector can start to be addressed. And some of these, of course, include putting in critical members of the workforce, which is a P&O, and to ensure also that there is a director of health institutions. And as we go along, I want the public to join us as we transform our healthcare sector here in St. Kitts and Nevis. I would end my opening statement there, and to the other sectors, I will leave it up to the other ministers, and the press would have much more time to ask questions of us as we seek to move our country and nation forward. Thank you very much.